Hello, my name is Andrea Pujazonros, and I'm a newly qualified pediatric advanced nurse practitioner in pediatric cardiology in Glasgow. And this poster is based on my dissertation for my master's in advanced nursing practice pediatrics in the University of Manchester. So the title is Introducing an Advanced Nurse Practitioner-led Pediatric Palpitation Clinic, a Service Development Proposal. The aim is to explore the feasibility and establishing an AMP-led pediatric palpitation clinic within NHS Scotland as a quality improvement project to improve timely access, reduce pressure on consultant-led services, and improve the quality of care delivered to this patient group. Pediatric palpitations are a common cause of referral to cardiology services. Even though most are benign, a small proportion are linked to arrhythmias requiring intervention. Increased referrals, long waiting lists, that limited specialist capacity create delays in assessment, which impacts both physical and psychological health of children and young people. In the United Kingdom, there are no dedicated pediatric palpitation clinics. Introducing an advanced nurse practitioner-led pediatric palpitation clinic could alleviate pressures on the National Health Service whilst improving the quality of care of children and young people presenting with palpitations. A literature review was undertaken to identify evidence from AMP and nurse-led cardiology clinics. A service development plan was then designed using the NHS change model and the model for improvement. A stakeholder analysis, governance structures, and stage plan do study act cycles were incorporated to ensure safe implementation and evaluation. The review demonstrated that nurse and AMP-led cardiology clinics are safe, clinically effective, and improve access, patient satisfaction, and service efficiency. Although pediatric-specific evidence is limited, national and international studies support advanced nursing roles in pediatric cardiology. The proposed service model outlines pilot implementation, evaluation, and potential for wider adoption. This diagram here represents the key themes and benefits of the AMP-led pediatric palpitation clinics. So we can see that they can improve the safety and clinical effectiveness, improve access and reduce waiting times, increase patient and family satisfaction, increase efficiency and optimization of resources. They support the NHS strategic aims, and they also support AMP role development. They can reduce the consultant burden, and for them it's very important to have training, supervision, and clinical governance. This other diagram here on the right-hand side, it's a pathway of a proposed AMP-led pediatric palpitation clinic. I developed this in conjunction with the cardiology consultant that would be doing the clinics with me. But obviously, if this is implemented in any other center, it can be adapted. It can be adapted depending on cardiology preference and after a wider discussion with the team that will be undertaking the clinics and supervising the clinics. So what we proposed is when we receive the referral from a clinician, this will be triaged by the vetting consultant, and then the patients that will be seen in clinic will be those that have symptoms of palpitations only, no exertional or syncope or chest pain, no cardiac history or diagnosis, no family history of sudden cardiac death, and a normal ECG. If all of these criteria is met, then these patients will be seen in the AMP clinic. And if any of these criteria is not met, then they will be referred to the consultant cardiologist and they will be seen in their clinic. Once the patient is referred to the AMP clinic, they will have a clinical history taken by the AMP. They will have a red flag screening, a physical examination, and also an ECG. And there is a guide here on what the red flags are. So this would be syncope during exertion, chest pain during exercise, palpitations, waking up from sleep, family history of sudden cardiac death. So this is under 40 years old, non-structural or inherited cardiac condition. And then depending on all of these, the patients will be stratified in 3 groups. So we would have the low risk, and these are patients that have a normal ECG, no red flags, normal examination, and a benign history, and these patients will be reassured by the AMP and they will be discharged. Then we would have intermediate risks, and these are patients that have a normal ECG, concerning history or examination, but no red flags. And these patients will be referred to the physiologist for further investigations, further testing, which could be echo, Holter, an ALIF core, or a loop recorder, depending on the patient. And then there will be patients that will be stratified in high risk. So these are patients that might have an abnormal ECG, or they have red flags, or an abnormal examination and history. And these patients are the ones that will be escalated to the consultant for assessment. So to conclude, an ANP-led pediatric palpitation clinic has the potential to enhance quality of care, reduce waiting times, and optimize resources. This project contributes to addressing a critical service gap while also advancing pediatric advanced nursing practice. Thank you for listening.